right, welcome to the February Board of Health public meeting. City of Revere, please stand for the Pledge of Allegiance. Pledge allegiance to the flag, United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, again, welcome, and my name is Dr. Drew Bunker. I'm the chairperson of the Board of Health. With me tonight is, to my left, Kathleen Savage, board member, and Viviana Catano, also board member. Invited municipal staff is Lauren Buck, who's Director of Public Health, Michael Wells, who's Health Agent and Director of Inspectional Services, and Paula Supelvita, who's Board of Health Clerk. Today we will discuss some topics, first being review and approve the minutes from the January 23rd, 2025 meeting. So I'll just ask the other board members if they approve of those minutes.
Yes, I approve the minutes.
I approve of minutes.
Excellent. Great. So next is going to be the public health communicable. I also approve the minutes, sorry. Next is the public health communicable monthly report with Lauren Buck.
Oh, thank you. Okay, so for the February communicable monthly report, we've had a significant increase in influenza cases. We had 528 over the last month, which is a significant amount. Just a reminder that it is still upper respiratory infection season, and flu vaccines are out there. Staying home if you're sick, going to a doctor if you're sick are all super important because that is an extremely high number for 1 month. Again, 528 cases of influenza this month for the city of Revere. Second, the public health update. So the Massachusetts Department of Public Health has issued guidance regarding priorities for surveillance of the H5N1, that's the avian flu that's been in the news a lot recently for residents. H5N1 human cases have been rare in the U.S. and primarily associated with direct contact with infected commercial chicken and turkey flocks or infected dairy cattle. No human cases have been identified in Massachusetts. Most confirmed human cases have been mild. However, severe disease is possible, and there has been one fatality in the U.S. reported in an individual with pre-existing health conditions. There have been no human cases of H5N1 in Massachusetts, and surveillance of milk from dairy cow herds in Massachusetts has remained negative. H5N1 is widespread in wild waterfowl in the Commonwealth. Next, new provisional data from the CDC's National Vital Statistics System predict a nearly 24% decline in drug overdose deaths in the United States for the 12 months ending in September 2024 compared with the previous year. This is the most recent national data available and shows a continued steep decline in overdose deaths. This is national data, and I just want to say data specific to Revere in Massachusetts is not available for 2024 yet. It usually comes out sometime in the spring, in which we will update the members at that time.
All right, thank you. Next is the Inspectional Services Monthly Report with Michael Wells.
Thank you, Dr. Bunker. Inspectional Services Report for the month of February is as follows. Interior Housing Division, we performed 136 Certificate of Fitness inspections. We performed 15 Certificate of Fitness re-inspections, 2 interior complaint re-inspections, and 1 pool inspection. On the Food Inspection Division, we performed 32 routine inspections, 5 re-inspections, 2 complaint inspections, 1 pre-opening inspection, and 6 temporary food service inspections. On the Exterior Sanitation Division, violations issued, accumulation of litter, garbage, trash, and debris was 28. Carts out at improper times was 5. Dumpster overflowing violations were 46. Improper placement of garbage, trash, and bulky items was 499. 1 violation for junk heap, illegally parked vehicles, 1 violation for rodent harborage, 1 violation for unclean, unsanitary land, and 208 violations for snow and ice. I just want to repeat, as I have in the past couple meetings, during storms, it is the responsibility of the property owner, residential and businesses, to remove the snow in front of their property, on the corner of their property, to clear, so we can ensure we have clear pathways for all of our citizens and residents that are walking on foot throughout our city. Thank you.
Thank you, Michael. Next is going to be the regional epidemiologist presentation from Vanessa Gudado Menjivar.
Hi, are you able to hear me?
Yes, we can.
Perfect. So I'm going to go ahead and share my screen. Give me 1 second as I set up. Perfect. So thank you for inviting me today. I will be sharing some findings that I have from the community health assessment. Part of my work has been completing this health assessment for the cities of Revere, Chelsea, and Winthrop. And the main purpose of this assessment, as a reminder for everyone, is really to identify and prioritize the needs of those living in these areas with an emphasis on diverse population and those experiencing inequities. We are doing this through a survey, focus groups, and interviews. And the goal is that afterwards, we will come up with a community health improvement plan. With this plan, we will strategize with different CBOs, municipalities, and residents to come up with goals for the next 3 to 5 years. We have been conducting the health assessment for about 4 cycles now. We work alongside with the hospitals, and that includes Beth Israel, Cambridge Health Alliance, and MGB. And we work together to share the data to make sure that we're not having any duplication and to prevent survey fatigue among residents. So really guiding this assessment are these 4 principles that I have here. The first one being equity. The entire purpose of this health assessment is to work towards the systematic, fair treatments of all people. And the way we do this is through collaboration. We have concluded with a steering committee, and the steering committee is helping with the outreach in order to target vulnerable populations and get the survey and focus group out. We are intentionally engaging with people to make sure that those who are not often heard are being reached out this time. And of course, always being very intentional with what questions are asked and what the purpose of those questions are. So what I'm showing next is a timeline, and this is a timeline we're working for the health assessment. The kicked off was around August. That is when at MEPC we reached out to various members from all 3 municipalities to form the steering committee. It consists of 20 active members, and we meet every 3 to 4 months to go over material. Since of August, we have been working on data collection, both secondary and primary data collection. For secondary data collection, they're just pre-existing information that we're getting from online public sources. And then the primary data collection has consisted of the survey that we worked alongside with hospitals and steering committee members to get input, and then the focus groups with the one-on-one interviews. This is still open at the moment, so the information I will be sharing in a bit are all preliminary data that has not been finalized. But the survey and interviews will stay open until the end of April. And by then, we will be able to start working on areas to prioritize to come up with our health assessment, but also our improvement strategies and target. Specifically,
Vanessa, do you mind putting it in presentation mode, the the PowerPoint?
Yes, of course.
Sorry.
Give me 1 second.
If it can't or you don't want to, that's fine. It'd
Oh,
just be a
no.
little bit easier to see.
Yeah, of course. Let me just stop sharing my screen for a second and just reshare it. Okay, is it full on your end?
Yes, great.
Is it-
That looks great. Thank you.
Oh, amazing. Thank you for letting me know. So the remaining information will be focused on just Revere data. Let me just go back one. Yes, it would just be all Revere data. So what I have here is a list of secondary data that I have pulled. We have been pulling data from the US Census Bureau, the Behavioral Risk Factor Surveillance Survey, the Youth Risk Behavior Survey, data from the CDC and National Vital Statistics, the Massachusetts Community Health Equity Survey, and then other local sources of data. In Revere specifically, working with Cambridge Health Alliance, we have conducted 6+ interviews. We have conducted an interview with a clinical social worker from Cambridge Health Alliance, with an educator who was focused in environmental justice, the director from Revere Community School, someone from the Disability Commission, someone from Myra, and then a few residents from Revere itself. From the survey, we are currently at 402 respondents, and then we have conducted 7 focus groups. One was Arabic speaking group from the Revere Arabic community. 2 of them have been from health workers. One group was from the Cambridge Health Alliance health worker, and the other one was from MPC community health workers. We have done 1 focus groups with the housing family, 1 focus group with the women encouraging empowerment, and then 2 focus groups with the regional mental health team. And looking at the surveys itself from the 402, which is a combination from North Suffolk, but also Cambridge Health Alliance, I have here some of the demographic data that we have gotten so far. So about 38% of respondents report a language other than English as their primary language spoken. 68% of respondents have been women so far. 13% identify as having a disability, and then 10% identify as any of the following: gay, lesbian, asexual, bisexual, pansexual, queer, or questioning. I also have the breakdown from race, ethnicity, and also age. So looking at race, we're looking at about 39% identify as Hispanic, following with about 20% identify as white, 18% as Black/African American, and 9% as Asian. This does not include the full breakdown. I just selected the top 4 as an overview for today. And then for age, I have the following breakdowns: under 18, 18 to 24, 24 to 44, 45 to 64, and 65 plus, with the percentage for Revere. Given that the survey and focus groups are still ongoing, we have not decided what the priorities are for this health assessment. The steering committee is meeting next month with the goal to start the beginning conversations of this. That being said, the survey was guided by the previous health assessment conducted in 2022. So as a result, from the basic findings I have looked at, we are pretty confident that the priorities will remain pretty much the same, or at least big pictures will. So for the purpose of this meeting, I have kept the 4 priorities that were identified in 2022 to provide some of the breakdowns for the following data. So in 2022, it was identified that housing, behavioral and mental health, economic stability and mobility, and environmental health were the 4 priorities that emerged. So using those categories, I have pulled data from the current health assessment. And looking at the first category of housing, what we have here as primary concerns, these concerns are from the focus groups and interviews. There have been mentions about issues with affordability. There's an increased high cost of living. There have been mentions of displacement and also gentrification. And there have been mentions of overcrowding due to cost and limited housing availability. From the survey end, about 48% of Revere respondents, when asked what they would like to improve in their community, selected more affordable housing. This was the #1 response for this question, and this was also the #1 response for Revere residents in 2022 for that health assessment. 32% would also like to see better access to housing support services, and about 16% either selected disagree or strongly disagree with the statement about feeling secure about their current housing situation. And then one of the questions was asking if they had any issues paying for the following blank items in the past 12 months. And about 31% stated they had trouble paying for either rent, mortgage, house taxes, or house insurance. And these themes are pretty similar to the previous findings from 2022. The next theme that was identified previously was behavioral and mental health. And again, similar pattern from the concerns from the focus groups. There have been mentions of social isolation concerns among older adults, and this has been connected to the increase of casino usage. There have been mentions about concerns about navigating the behavioral health system and a generalized concern among youth mental health. In the bottom, there is a bar graph. This bar graph comes from the survey itself. It was a question asking if there were any barriers with access in mental health care and what those barriers are. About 21% of people did say they did not face any barriers, but among those that did select something, 19% stated that cost was the main concern, followed by fear of discrimination/stigma, and then lack of information on available service. Continuing on from the survey, about 28% of Revere respondents selected mental health as one of their top five health problems that matter the most in the community. And then overall, one of the questions was asking about the mental health of people in their community, and about 54% described it as either fair or poor. That being said, 73% do believe that the healthcare in Revere does meet the mental health needs of people like them, and that's based on their demographic features. The third theme identified was economic stability and mobility. This from the focus group and the surveys were pretty similar with the themes that emerged, that being limited opportunities for career advancement, economic insecurity, and then high cost of childcare. When it comes to main barriers for finding/maintaining employment, 30% select limited opportunities for career advancement, followed by just lack of job openings in their field, and language barrier. 10% did select that they did not face any barriers. In Revere specifically, when they asked about if they're satisfied with the economic opportunities in Revere, about 32% disagree or strongly disagree. When it came to selecting top five concerns for them, 45% did report wanting better access to a good job, and about 21 responded wanted more affordable childcare in their city. The last theme that was identified previously was environmental health. And from the focus groups, conversations that came up was regarding water safety, and that included both drinking water at home, but also water from the beach. There was concerns about lead in housing and water pipes, and then the concept of this lack of physical open space for people to attend. In general, most people did select that they wanted to see less environmental health issues, and that included less trash and litter, less air pollution, and less noise pollution. And it was about 25% across. And one of the questions was asking about their housing environment, and about 11% strongly believe their house is not safe from pests and mold and of good quality. That being said, this survey and this health assessment is still going on. It is in the process of being wrapped up in the next month or two, so we are hoping to see more respondents. In 2022, there are about 700 for Revere, so we are aiming for about the same sample size this round. Next month, we'll be having conversations about what the priorities are. They may change, and they may not be the same to the ones I just mentioned, but those conversations will be going. And once we determine these priorities, we will able to really do exploratory data analysis to really understand how socioeconomic factors impact the priorities. What I provided for today is just overall descriptive stats. It is not stratified by age, it is not stratified by race, ethnicity, or other factors, but it will be by the final report. And then Cambridge Health Alliance has started listening sessions for Revere residents going over their findings. We are hoping to follow and doing our listening sessions around June for residents and CBOs that were part of it. And that is what I have for today. If anybody has any questions that I can help clarify, but I can stop sharing my screen.
Thank you. Thank you, Vanessa. Any questions from the board or? Yep, go ahead.
I have a couple of questions. Vanessa, what specific date does the survey close?
Yes, so the survey will be closing early April. There's no end date at the moment, given that we are working with Chelsea and Winthrop and we're coordinating with other hospitals and communities. It is going to be a flexible end date, but early April at the moment.
And has the survey been posted on like the City of Revere social media pages? And then another question, Lauren, that occurs to me is, I know Maddie, and I forget the official name of their department now. They used to be known like the ambassadors, the health ambassadors. And I know they're incredible at getting survey respondents. I know for that walk, bike, enroll survey, they were a huge player in helping us get some of that data. They got like 800 responses because they helped a lot with that. So my question is, can we ask them to help really push this? Because I think if we get a lot more people to participate, our data will be even better. So like if we could double this number to 800, that would be amazing.
Yeah, we can definitely have the community liaisons help. Thank you.
Thank you for that suggestion. I will reach out to Lauren afterwards and Viviana, maybe so I can follow up with the contact information.
Thank you. Actually, Vanessa, do you have any plans? So I noticed that your numbers for the 18 to 24-year-olds are the lowest. Those are tough people to get. Do you have any particular strategy or plan to reach them for Revere? I don't have a solution for you, but I'm curious if you have something you have thought of.
Yeah, so they are the lowest demographic feature at the moment. We are planning on holding some events at the library and hoping that we can possibly advertise there, but it has been hard to get that group to take the survey.
Okay. I think for the community health needs assessment, what I did for the walk, bike, and roll, and I believe I did it for this as well, is we send it to the high school librarian and offer the kids community service hours for taking it. So I send them back an email saying, show this to your vice principal, showing that you did take the survey. And so I think we got at least some responses from the high school, but I think this 18 to 24-year-olds are a little bit tougher to get because where are they, right? They're in college. Are there any incentives for residents to take the survey? Like, are there gift cards is there some incentives tied to this that we can promote?
There are incentives for the focus groups and interviews. If needed, we can discuss doing an incentive for the survey. There isn't at the moment, but having the incentive at the high school for seniors was a really big help for getting the under 18. So we're definitely willing to have those conversations if it comes down to it.
And then Vanessa, another place where like if you could get a team, I know like the First Congregational Church is serving a lot of people. Like 80% of their clients are from Revere. And that might be like a good group to go visit. I know they service folks by alphabetical, I think is their last name, so they don't see everybody the same week, but I think they get a good amount of people. That might be like a good location for you to collect some surveys. Another place, again, if you had boots on the ground, this is what I would do. Another place where you can get like a lot of people, if you had a team collecting surveys, would be like the faith-based organizations. So again, First Congregational Church, Immaculate Conception, the 12 o'clock mass gets packed with like 500 people. So if you had, I don't know, if you had a team and some incentives for folks to pause a moment or promote like QR code for people to take the survey. Thank you.
Thank you. That's a great idea. I will reach out. I am doing in-person outreach, so an in-person survey. So I will definitely contact them and see if I can set something up.
Great. Thank you so much. That will conclude this month's meeting. Thank you, everyone, for being here.